No problem. How are you, Miss? How are you doing
Good.
today?
How are you?
Oh, wonderful. We have a beautiful day here in Mississauga.
Yes, yes. Ours is all cloudy, but it's fine.
Ah, it should be okay soon.
Yeah.
Thank you
So,
so much.
thank you so much for taking the time. Um, we, I get a lot of questions about psychoeducational
Mhm,
assessments, um, especially when people have had their kids in the system for a long time, or even for a number of years, and they're it's not working, so they pull their kids out and they start to def- think they're homeschooling, and people suggest to them, well, maybe you need a psychoeducational assessment for your child, and people talk about it,
mhm.
but they don't really know what it means. I don't think they have some idea that it's going to be a magic potion that's going to fix everything that is an issue. So families come to me and say, do I need a psychoeducational assessment? I said, well, that depends on, what the issues are. And, when you change things up, you can't expect to see results immediately.
Right, absolutely.
It takes time. So, and some families have said, well, they had a psychoeducational assessment done, and that was why they pulled their kids out of school to do something different.
Mhm.
So I don't know a lot about the educational assessments, and so that's what I was curious about, because um nobody, I mean, other than just defining the term, you know
Right.
um what is it based on? Because if it's based on the conventional public school uh connection with a child, or is it really about learning?
That's a very good question, and thank you so much for reaching out to me. I'll be happy to explain what it really means. Um, First of all, I will just introduce briefly myself. I'm a school psychologist.
Yay.
I've been working in this industry for about 20 years. Believe me or not, my birthday is coming February 14th. So,
Hey. Yeah, I've been doing this for about 30 years. So yeah, I hear
okay.
you.
So I've been working for the school board in Toronto, but for the last 10 years or so, I've been also doing it in a private practice. And that's where I see a lot of students coming to me from private schools or homeschooling and so on. So
Which
the
doesn't mean the same thing to everybody. Homeschooling is it's a very broad term, because
Absolutely, they
yeah.
learn on their own pace, and this is completely different.
Yeah.
But answering your question, the psychoeducational assessment, mm, yes, in some ways, this is the legal document that allows the child to access, let's say, resources that will help them to learn on their own pace. So, for example, when I do the testing, I look closely at several different areas of child's functioning, which is cognitive, academic, social, emotional, memory, and a bunch of other processing skills. So what it does, basically, it helps to identify, again, strengths and weaknesses. But through the process, I'm able to make the identification if the child is gifted, for example, or if there is any kind of learning disability, anxiety, depression, ADHD, autism. So under, yes, please go ahead.
Sorry, I have a question. So when you have, what is it based on that it would qualify as gifted?
Based on the cognitive abilities and academic abilities. And this is funny now because each school board is different. found that at one point they came to the consensus of what gifted means. So
it's again like homeschooling. It means very different things to different people. When I tell people that my oldest daughter was academic, she
Mhm.
she knew her alphabet letters by the time she was 2. She knew the sounds of the letters by the time she was 3. She knew she was doing grade 4 level stuff at 4 years old. And at 7, she was tested at a grade 11 reading and comprehension level. She went to university at 13. So, but I do not consider her gifted. I consider every child gifted, because when they're allowed to progress in what they love, they will automatically learn it faster, retain it longer, and use it better.
I agree with you 100%. Some children, and I don't know about your daughter, possibly the system maybe it's a little bit
She
different.
was home educated, so I allowed totally unschooled. She was allowed to do whatever she was interested in. So
I
the
love
way
the approach.
I do my thing is like a buffet. Here's everything you could possibly imagine. What do you want to try? What do you want to look at? So rather than telling kids what to do, when to do it, and how to do it, not just at your own speed, but in your own depth. Like some kids will be really interested in something and then not care about it. Other kids will look about that thing and they will go deep dive. They will go for days, weeks, months, focused on that one thing. And when kids get that opportunity, I find that it's not so much a gifted thing as permission to do what they're naturally drawn to.
Yes, and that's you know, the really discussion about what giftedness is, and this is defined as, let's say, IQ score of 120 and above. With, you know, if somebody goes through this kind of assessment and receive the identification, the gifted category, it also allows them to, or makes it easier for them to enter any university in North America, for example, or have an access to some other programs and some memberships. And I see that, for example, at your school, you're doing fantastic. You're providing them with different opportunities like Minecraft or chess clubs and so on. Like I if I could, I would definitely send one of my child to you. And I was reading about your school, and I'm like, oh my goodness, Anthony would so much benefit from your approach. And you're right, some children are more self-driven and they will navigate towards things that are interesting. Some need a little bit more push. Some some are, you know,
Well,
need a little bit more time.
what I've noticed over 30 years is when the kids are allowed to do what they're interested in doing, they don't need the motivation. We don't have to externally motivate them.
Absolutely, I
They
agree.
will be self-motivated. So if they haven't found what their passion is yet, the other people might want to take over and say, well, do this, do that. So we don't have it much or any troubles with motivation, because we try to assist the students. So it starts with the learners and their self-directedness. So basically, here's the buffet. Nothing on that table is something you're interested in, then let's just keep exploring, right?
Is this, excuse me, is this a little bit like a Montessori school approach?
In an alternative way, yes, except that Montessori is still very structured.
Okay.
And Montessori doesn't allow for any fairy tales or fantasy or anything of that sort. So it's Montessori was very very focused on the specific realities, not fantasies.
I see.
And Waldorf is very natural, but not computer or technology, right? In the younger ages. So I we try to look at all the things. So let's say what I ask parents is, have you ever heard yourself say or think, all my kid does is fill in the blank?
Mm-hmm.
When you find yourself saying that, whatever that blank is, has value to your child. So that means that when we look at what the kids are doing, they're on Minecraft or on, games or Lego or whatever. Teenagers, they want to be YouTubers. And the parents don't value what those things are because conventionally they have no value to us as adults.
They have different experiences, you're right.
Right. So, but what I do is I observe as an anthropologist would the subject, what are they doing? What motivation does it provide them with? With a kid on a computer, let's say it's the challenge of meeting the criteria that they need to level up.
Mm-hmm, mm-hmm.
What do they need to do to get this next weapon? So they have to actually critically think about what their character is doing to proceed to the next level, to achieve the next level. That is a good critical thinking skill.
I fully agree. That's
But
how
parents
it should
don't
look like.
recognize it. Most adults don't acknowledge the value in everyday things. So for instance, if our students are sick for the day or whatever, because we have voluntary attendance, they only come when they want to. And the thing is that they are in full-time every day because learning is like breathing. You do it 24/7. If you're sick on the couch, you're learning how to listen to your body, how to describe what you're feeling, how to take, care of yourself. Your parents telling you, oh, you need to do this to take care of the headache. You need to eat food or drink lots of fluids. So that in itself is still learning. So we don't consider that an absence from learning. And even doing what we would consider nothing, just daydreaming. Our brains are so overstructured. Our children's brains are so timetabled structured. You get up, you get dressed, you do this, you do that, you do the next thing, you go to school, you do all your subjects, you come home, you go to tennis lessons or dance classes or karate or whatever, and then you get home and you go to bed. You have no time to think, no time to relax, no time for your brain to just do what it's meant to do.
Right.
So daydreaming counts. Daydreaming matters in our perspective.
And from what I hear, you definitely provide a unique opportunity for students to experience all of this and to learn from these experiences. Unfortunately, the regular schools usually do not have this flexibility. And that's where a lot of even talented students fail.
Yeah. Or struggle. Just
struggle.
struggle. So how does a psychoeducational assessment help a child in school?
In many different ways from what I observed. And just on a similar note to what you said, throughout the years, I started noticing that a lot of academic difficulties stem out from emotional difficulties, really. The children are not very resilient. They don't always know how to deal with stress, and this causes some behavioral difficulties. Therefore, my list for an assessment was like 20 students along or more. And that's when I came up with the program. I called it Ideal Me, where I told the principal, bring them all to me, the worst of the worst, these children who struggle, who you cannot.
Those are the ones that do the best in our
Exactly.
program.
And in 8 weeks, my list for assessment was so short. And I will explain how I achieved that, because I was doing basically what I'm doing when I'm assessing the child. So I'm allowing them to discover their strengths and weaknesses.
Yeah.
The moment they started to understand it better, they started also learning how they can use their strengths to overcome their difficulties
Yes.
and communicate it with others. And that's when the magic started happening. I will be honest with you. I also had a session with parents and with teachers, so they also could benefit from from this knowledge. And honestly, most of the students, to my knowledge, were very successful later on in terms of their educational pathways, and not only, also emotionally and socially. So we think alike from what I see, but in terms of the assessment, it provides some information about this child's functioning. It helps the child to build the confidence, but it also, in my opinion, helps educators to better understand how to approach the student when there is a difficult moment. That's what I
Do you
see.
find though that when it's done, is it being followed? Is it being implemented? Are the, because most of the
Definitely.
teachers that I know, they will argue because they have, 20 to 30 kids in a classroom and every one of them is on an IEP. And they simply do not have the wherewithal to accommodate every individual child's natural needs in education.
As I said before, I think that teachers also need to be educated. It's not that they don't want to help. Sometimes they really don't know how to help.
Absolutely.
And
And trauma informed too, because trauma informed is so important. We don't know what our kids are coming
absolutely.
from or what
Very,
they experienced. I'm a trauma treatment foster parent.
oh,
So
really?
yeah. And currently I have guardianship of my two grandsons, 2 and 4 years old.
Oh,
And the 4-year-old he's been diagnosed with ASD, but to be honest, I went with him to the diagnosis. They watched him play for about 20 to 30 minutes and signed the paper saying he had ASD. There was no, like, it was observational only. And I could tell where he was focusing differently. So I know how to talk with him, to communicate with him, to get on his eye level, to listen to what he's saying, or when he's frustrated, to help him calm and wait until he has a way to soothe his own anxiety, right? Without fear. Because I think fear is such a part of it. Fear of not getting what they need, fear, and that causes meltdowns, right? Fear of not being heard, not being respected. They don't understand those words, but they know the feeling of it.
absolutely.
So how young do you work with? How young kids? And my other question, sorry, just I'll put these two together. For the IQ, at what age do you think an IQ is really effective?
Oh, well, these are both very good questions. I help parents of children as young as 2 years old. I would not necessarily go and work with the child.
Yeah.
But I see again that a lot of parents need guidance, for instance, how to implement positive discipline, the reward system, as you said, how to motivate the child from the early years. So it helps very often, especially with the younger parents or new parents. When it comes to IQ, and as you know, mentioned before, that you noted that your daughter was academically very oriented and talented academically, and you kind of felt what to do to kind of promote it. And it went well. Again, most parents don't really know, right? They only
Right.
know what they experience in their own schools. Um, I do assessments, let's say, with children, believe me or not, I think the youngest one who actually was admitted to Mensa was 4-year-old boy from from London. So, and now advantages and disadvantages. Sometimes when I see that the child is very bright, but because, parents put so much effort to train them almost for this test, I usually say no to these assessments because I don't want to harm this child.
Yeah.
But and that's why I always have the initial consultation to meet the child, to meet the parents, and to see what is going on. Believe me or not, I had a client from St. Catherine, and they said, "Hey, listen, we have 2-year-old. We want him to be the youngest member of Mensa." I said, "Absolutely no. No matter how bright your child is, I'm not doing that." But regardless, people say that at around age 7, you can say that IQ becomes a little bit more stable. But still, if the child is talented, if they show these talents and enthusiasm for learning, I wouldn't mind testing them at age 4, just because that's where parents also have some guidelines. That's their area of strengths. That's what he needs to work on. And I always tell them, just don't push them. That just let them play, and through play discover what they want to do. But some children, they're really, really so academically oriented that there is no point to really tell them, don't do math, just sit and play with this teddy bear because they are bored and get into trouble. So it really depends on the child. However, if we are able to identify giftedness, autism, learning disability, or any difficulties, I would not again diagnose learning disability at age 4. But if we are able to identify any strengths and weaknesses early enough, then I think that educators and parents can do a lot to help to guide the child to reach their full potential. And finally,
Yeah. Now, I mean, like you said, there's ups and downs in all of it. So my
right.
oldest daughter also subsequently suffered from PTSD due to an attack that she survived. And so it's been a very big challenge for her, even being so academic at a young age. But some of the other challenges we had, allowing her to totally be the academic she wanted to be, was that she did have a social issue. I don't say socialization. She was social with adults who thought on a higher academic level, enlightened, and being able to talk about more challenging, more complicated things. So she was very social with people who were older, because
Right.
she felt like she was intellectually on the same level, or at a common level. But there was a time when, if you remember, the Swiss air flight went down, and it was in all the newspapers. And my daughter and I had a running game where, the first person to get to the newspaper in the morning read it to the other. And she got to the newspaper before me, and I think she was maybe 8. And so she had already been assessed. Because of my divorce, my husband insisted that she get tested, because now that we were separated, he disagreed with our homeschooling. Before, he was all for it. But having her tested and getting the results as being, at a grade 11 reading and comprehension level, grade 6 grammar and spelling level, and she was only 7. She would have been in grade 2. So that, so she really understood what she was reading in the paper, and she was distraught from the emotional trauma of simply reading the article for at least 2 or 3 days, visibly. She was very emotional, and she felt that loss for all those people very personally and heavily. And that kind of emotional response, it was hard to find appropriate literature for her to read at that age. So, you know, yes, I want to say you can read anything you like, but that's not necessarily appropriate. You know, so how do you balance the emotional and the and maybe, like, I don't agree that every child is the same. I don't agree with age segregation. But if a child is emotionally sensitive and highly academic, how do you process that?
Well, first of all, there is a bunch of research showing that emotional intelligence is much more important than IQ, so your intellectual abilities. And that's sad, but I see a lot of gifted children failing because they don't know how to relate to other people, or they don't know how to process conflict, some conflicts and some difficult situations.
She was just bored with her peers.
Yeah,
Her
that's
peers,
right.
yeah.
So you know, that's what I'm saying. That's the ideal me program that we are doing to teach children, or at least show them and guide them how to learn that further, how to
Right.
react in a certain situation, how to calm yourself down, how to process it. So for instance, what can you say to yourself to make you feel a little bit better?
Yeah.
It all comes with practice. So
Yes.
not given, and you're right, and we're all different, and some people are emotionally a little bit more fragile, but these are really skills that we can learn.
Yes.
These really things we can learn. We cannot pretend that we are smart. I think
No.
we cannot fake it, but I think that we can fake emotional resiliency, and this is the only thing I say: fake it till you make it.
Yes. Yes.
Because this is something you can do through practice. And of course there are some extreme situations, traumas and so on,
Right.
and some problems that need treatment.
Yes.
But if talking about, let's say, 98% of population, I would say that with correct education, and not only academic but also social emotional, we can really build very resilient societies and countries, and that's my goal. Miss Howland.
Absolutely. I'm sure it sounds wonderful
I'm
what
really
you're
doing
doing.
a lot of pro bono work. I also run the Ideal Me and the Richmond Foundation.
Yeah.
So we are award outstanding young people in the area of humanitarian activists.
Awesome.
So yeah, that's the goal.
So we have a very wide array of students, and I think the way I've always said it is that there's no one right way to learn, and there's, you know, every child is gifted in their own way.
Right.
We always look at the strengths rather than the deficiencies. I don't know if you're familiar with Dr. Charles, oh, of course his name's escaped me for 2 seconds. He runs the the Holistic Brain Institute. His website is brainfitkids.com. brain fit, Charles Solis.
Oh, yes.
Yes. And I met him like in 1996, started working with him. He's amazing. And they train the parents or the family to support the student, the child who has the challenges in a strength-based way, so that other parts of the brain can learn to take over perhaps the parts that the brain is not there or not able to function with. So they are curing mobility and deafness and blindness. And it can be done. A lot of people don't realize that those things can be worked on. Like if you have a child that's immobile, but they can move their thumb a little, then you work on, okay, can we go round? Can we process different movements that the thumb can do, and until it takes on the next ability, right?
I'm very familiar with the research on brain neuroplasticity.
Yes.
I was extremely interested in this topic.
I was at a full day seminar, which was overwhelming, with Dr. Martin Teacher.
All right, yes.
Yes, and just my brain hurt afterwards. It was so fascinating. Every single minute of that whole day. I wish it could have been a week or more, but it was really fascinating. So yeah, I'm so blessed that you were able to make the time for me today. I know it's lunch hour and you probably have lots of things to get.
I have a child waiting for me,
Yes.
but he's working on some assignments. Oh, thank you so much for,
I want to be in touch again, and find out more and how we can collaborate.
I would love that. I really would love that for many different reasons, and especially that I see we have similar visions. So, Ms. Harlan, if you're okay with that, I will send you some information about the workshop I'm going to run on the 18th.
Perfect.
I'm here in Mississauga, but if you have any ideas or any, maybe even for the future, maybe we can do something together.
That would be great.
Yeah, I would love to help in
Okay.
the best of my
Thank you
ability.
so much.
People like you,
you
it's
so
a
much.
blessing.
Okay. Take care and you have a great day.
I need
And
to.
we'll keep in touch. Bye-bye.
Absolutely. Thank you so much. Have a good day.
You too.
Thanks.